Now, the governor says Louisiana still ranks very high, third in the number of deaths per capita. Fortunately, the state has a renowned research institution on the forefront in the fight against the pandemic.
Today, doctors at LSU Health Shreveport gave an update on their new lab and clinical trials. NBC6's Alexandra Meacham shares more.
With LSU Health Shreveport creating the Emerging Viral Threat Lab a few weeks ago to study COVID-19 and its possible resurgence in the future, they've been able to confirm cases in nursing homes and small hospitals while helping caseloads in central Louisiana and Baton Rouge. They're sending a mobile testing van to federally qualified health centers in rural areas. People will be swabbed in their cars.
Week from Saturday and the following Saturday, we are testing in the MLK area. From 10 to 2 at the David Raines Clinic. Also setting up screening dates for Cedar Grove neighborhood, the Moortown neighborhood, Gillum in North Caddo Parish, Haynesville in Claiborne Parish, and Minden in Webster Parish.
LSUHS has initiated a new research effort, a serology lab, studying those who've had the virus and how their immune system reacted.
Because individuals can have a little bit of the antibody, or individuals can have a lot of the antibody. And we really want to use the plasma that has a lot of the antibody because it's most likely to be protective.
Dr. Martha White, the Regional Director of Public Health, says these treatments have helped her husband, who's in critical but stable condition from COVID-19.
I know that the convalescent serum was beneficial to my husband. I know that it stabilized him at a time when he was on a downward trajectory.
Dr. White encourages those who've survived COVID-19 to donate their plasma.
You will be doing something amazing to help other people and their families.
Was Alexandra Meacham reporting there. Dr. White says blood banks still need donations regardless if you feel that you've had the virus or not and could not get tested. Well,